looks like skin is mildly irritated. Not too much, but is doing okay. Should recover nicely without too much proper treatment. Okay, let's go ahead and take a quick look right here. Okay. Very nice. Very nice. Okay, let's take a look in the eyes. Okay, eyes seem to be responding. Very good. Very good. Okay. Really nice. Good look. Okay. Let's take a look at the top. Look at the scalp. Okay. How about this side? Okay. Hey. Can you respond yet? Are you... Hello? Hey. Oh, yeah, perfect. Okay, well, listen, I am Dr. Chris, and I am taking care of you at the moment. Well, I've been taking care of you for quite some time. Do you know what happened to you? Well, apparently you were in a pretty bad accident quite some time ago. About 75 years to be exact. And you've been essentially frozen, like cryogenically. And we've been trying to find ways to bring you back. I mean, you were alive, but I suppose we were trying to find the way to properly bring you back without having you have any type of motor problems or any type of dysfunctions or any type of brain injuries. So, how are you feeling? Okay. Alright, perfect. Okay, so at the very least, seems like the general thing that we wanted to do is okay. Let me just go ahead and enter this information. There we go. Okay, so yeah, you've been frozen for about 75 years, and when you were found, they noticed that you were still alive. Now, it's taken some time to be able to bring you out of your coma, but it seems like you're doing well now. So what we're going to be doing now is we're going to do a cranial nerve exam, essentially to test out your motor functions and just make sure that everything is working as it should be. All right. All right, perfect. So I'm going to go ahead and just begin. I'm going to go ahead and just begin just by continuing to look at some of the details right here on your face, okay? I just want to make sure that your skin is okay. Alright. Very good. Very good. I just want to make sure. Okay. I'm going to go ahead and just move your head just a little bit. Okay. Any pain? No. Any pain this way? Alright. How about this side? Alright. I'm gonna very quickly test out, see what the sensitivity on your face is like. Alright. Alright, perfect. So right here I do have a pair of tweezers. Obviously we have a pointy side, alright? And I do have this ear cleaner. It's basically just gonna be just to test out if you can feel a soft and a pointy. Okay, a sharp and a dull, essentially. Okay, so I'm just gonna go ahead and just have you close your eyes. Very good. And just gonna boop. You felt that one? Okay. Just let me know every time you feel it, so you can say okay or yes or there. There you go. Okay. Sharp. Sharp. Soft. Sharp. 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 Soft. Okay, good. Very good. Alright. So, I'm going to go ahead and just do a little bit of a stretch right here on your eye. Okay, just to see how the elasticity around your eye is. Alright. So, if you will. Okay. Yeah, that's pretty good. Let's go ahead and take a look at the other side. Okay, good, good, good. And if you will, please just go ahead and just close your eyes. I want to see if the orbital around your eye has any kind of debris in a way, I suppose, or something that might be able to get in there and just cause the orbital around your eye to feel a little tense, a little tough. Okay, so please close both of your eyes. Good. I'm just gonna do one at a time. Okay. Very good. And I'm gonna go ahead and do this side as well. Good. Good. Very nice, very nice. Alright. So, if you will please, just give me 1 second. I'm gonna go ahead and grab my mask so that I can get really close to you, and this way I'm not breathing right on top of you, alright? Alright. Alright. Since I will be getting fairly close, that's all. Okay, so I'm just gonna go ahead and ask you to close your eyes. Very good. I'm just gonna go ahead and lightly touch you on the sides of your face, and I just need you to let me know if you feel any type of pain, or if you can actually feel that there's a difference on the left and the right. Okay, so you have to work with me here. Very well. Okay. Okay. All right. Very good. Very good. All right. And how's that? All right. Okay. Perfect. Perfect. All right. And all right. Seems like so far in that regard you're okay. What I'm gonna have you do right now is I'm gonna have you do a taste test. So all I need you to do, all I'm gonna require you to do is just to stick your tongue out, alright? And I'm just gonna give you a little dollop of this. Now, please remember that under no circumstances is there a wrong or a right answer. It's up to your interpretation. We do have a list on the little container letting us know of the possible flavors. Okay, so here we are. Go ahead and just stick your tongue out. Very good. There you go. And what flavor was that to you? Okay. Very good. Okay, seems like you are a type 1, at least in regards to that favor. So, there's 3 possible types. Okay, we have another one for you. We have another one. Okay, so, here we are. And of course, remember that the color has no bearing. It's mostly there to confuse the patient to see if there's any kind of placebo effect. So, once again, I'll ask you to stick your tongue out. Very good. And here you are. There we go. There you are. And what did you think of that one? That one, you like the flavor of that one? Okay. Okay. And, yeah, okay, I got you. Okay, so, awesome. Very good. Okay, good. And now for the last one. Let's see. Let's go ahead and grab this one right here. Let's go ahead and grab this one. Let's go ahead and grab that one. Here we are. Alright, and this should be the last of the taste test. Here you are. Good. And what did you think about that one? Okay. And, okay, perfect. Very good. Very good. Alright. Good job. Okay. So while we're still here doing the whole taste test and everything, I figured we might as well go ahead and test out your sense of smell. So, but we're not going to go too extensive. We're only going to do one. Alright. So I have one right here for you. All I'm going to need you to do is just take a nice deep breath. Take a nice deep breath of this particular smell. There we are. There we go. And please just go ahead and let me know, what do you smell with this one? There you go. A little more. There you go. How was that one? Okay, good. There you go, very well. Let's go ahead and just drop that one down. You're doing really well so far. For someone who's been frozen for quite some time, you're doing really well. Perfect. Okay, so I'm going to go ahead and start taking a look at your eyes now. Mostly going to be checking first of all to see if there's any kind of damage inside, see if you have any kind of cataracts, see if maybe one of your eyes isn't reacting to light, see if your eyes are maybe lagging a little bit. So give me one moment just to set up and get this tool out. Okay. Here we go. Okay. So, what I'm going to need you to do is just go ahead and look as straight as possible as you can for me. Particularly if you can, right about here. Okay. You're going to be taking a look at this eye on this side. And then we're going to go ahead and switch. Okay. So, let's go ahead and start. Okay. Can you please look directly into the light? Good job. Good. Okay. Very good. Very good. Good. Okay, and we're going to do the same thing on this side now. So if you will, just look right about here. Very good job. Good. Just look right there for me. Very nice. Very good. Okay, and now can you look directly into the light? Good. Good job. Good. Very good. Doesn't seem to be any type of damage, at least at the moment, with your eyes. We will need further testing in the future. Okay. So here I do have a light for you. I do have a pen light, and what I'm going to ask you to do right now is I'm just going to ask you to follow the light, okay? I'm just going to ask you to follow the light, that's all, okay? Just with your eyes, not with your head, okay? So here you go. Just follow this light for me. Very good. Good job. Good. I'm going to move it upward and down. Good. Tell me, can you look at the light and now look at my finger? Good. And go back to the light and look at my finger. Look at the light and look at my finger. Good job. Can you please cover one of your eyes? So let's cover this side. Good job. And just follow the light. Very good. Very good. Good. Good job. And I'm going to do the same thing here. I want you to look at the light and look at my finger. Look at the light and look at my finger. Good. Look at the light and look at my finger. Good. And now let's go ahead and switch. Good. And now you're just following the light. Very good job. Good. Good job. Amazing, amazing, amazing. Good job, my friend. Good job so far. I'm going to go ahead and do the same now. Look at my finger and look at the light. Look at my finger and look at the light. Look at my finger. Look at my finger and look at the light. My finger, the light. My finger, the light. Good job. All right. You can close your eyes for a moment if you need to. I'm sure that they're probably very dry. Okay. So now I'm going to go ahead and have you just look at my nose. You're going to look at me right here. And all I'm going to be doing is exactly what you see me doing. And all I need you to do is let me know when my finger leaves your peripherals, okay? Very good. So we're going to start right here, okay? And away we go. Yes, both eyes. Both eyes is okay. Good job. Just like that. Good. And now this way. Good, 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 good. Very good job. And now, go ahead and close one of your eyes. So we're going to start with this one once again. Very good. Here we are. Good, 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 good. And now we're going to go the other way. Good, 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 good. Amazing. Very good job. Very good. And now I would like you to go ahead and switch eyes. Good. So now we're going to go ahead and cover that side. Good. And now go ahead And let me know when when the finger loses, when you lose vision of the finger. Good. Good. Do that one again. Good job. You can go ahead and relax. Okay. All right. So, if you will please, I'd like you to go right now. Just go ahead and look straight up for me. Very good. And now look to the left and to the right. And now look straight down and close your eyes. It's okay. Keep them closed for a second. And now open them. Okay, good. I want you to go ahead and close them once again. Okay, just keep them closed for now. And when you open your eyes, I want you to find the light and look directly at it. So close your eyes, keep them closed. And now open your eyes. Good. Close them again. And open them and find the light. Good. Once again. Close your eyes. And open. Good job. Good job. Here's what we're going to do. With both eyes open, I'm going to put my hand right close to your face, just like this. And I'm just going to go ahead and have the light pass through my fingers. Just like this. And I just want you to track the light. Just want you to track the light. Very good. That's it. Just follow the light with your eyes. Just track it. Good. You're doing amazing. You're doing amazing. Very good job. Very good job. Okay, so the next test is going to be a red saturation test. Okay, so essentially, I'm going to show you something, the color red, but not this one. This is a little too dark. It's going to be a little more vibrant. So I'm just going to ask you to close one of your eyes. So we're going to close this one once again. Good job. And you're just going to let me know if at any point with the eye that you have available that's open, if the shade of the red changes to you. Okay? Very good. Okay. Anything? It was always the same shade? Okay, good. And now switch eyes. I'm going to perform the exact same thing. Okay. Alright. And did they change for you that time? Okay. Very good. Thank you for letting me know. I would like to actually do that test with both eyes open. Okay, so we're going to start from this side and you're going to do the exact same thing. So let me know if the shade of red changes. How was that time? Okay, good. Good job. Good. Very good. Okay, so I'm going to go ahead and just check I was about to do your shoulders and see how everything was working, but right before we do that, I do want to go ahead and have you let me know which of my fingers moves first, just to be sure that your reflexes are working correctly for your eyes. So, here we go. You're going to let me know left or right, okay, or both. Ready? Good. Very good job. And last part of the test is I want you to close one of your eyes. So we're gonna once again close this side first. Good. And you're just gonna read out some numbers for me as I show them with my fingers, okay? Good. So here we are. And go. Good. I'm going to introduce my second hand, and we're going to keep doing the same thing. Good. Now switch for me. I'm going to do one at a time first. So, good. Good. And now both hands at the same time. Good. You can open both your eyes now. Good job. Good job, good job. Alright. Alright. I do have one more thing to do. One more thing for your eyes. Alright. Here, I have a Snellen chart for you. All I need you to do is close one of your eyes. Very good job. And go ahead and read this letter for me. Good. And this one. Good. And this one. Good. And this big one. Good job. And can you read from the third row? Can you continue? Good. Let's go ahead and close your right eye now. Good. And here we are once again. Can you read this letter for me? Good. And this one? Good. And this one? Good. And can you read the fourth letter, the fourth row and on? Good. And now with both eyes open, can you please tell me what color this is? Good job. And can you please tell me what you see right here? Right there. Good. Okay, perfect. That covers your eyes. And now I'm going to go ahead and take a quick examination of your muscles around your muscle coordination and strength, okay? So, I'm going to have you go ahead and close your mouth. Good. And I'm just going to put my hand right under your jaw, and I just want you to open your mouth, okay? I'm going to put a little resistance, and all I need you to do is fight it. That's all. Okay? So here you go. And go ahead and open your mouth. Good. And I'm going to put my hand on your cheeks. And I just want you to smile and bring your cheeks all the way up. Okay? So here you go. And go ahead. Good. Very good job. And now I'm going to have you stick your tongue out. Good. And now open your mouth as wide as you possibly can. Very good job. I'm going to put my hands right on top of your eyebrows, and I just want you to move your eyebrows upward for me. Okay? So, go. Go ahead. Good job. And now I'm going to put my fingers just like this, okay? But I want you to stay in this position. And then I want you to go ahead and furrow your eyebrows, essentially, okay? Yeah, and I'm going to try and resist that. So, here you go. Go ahead. Good. Good job. And let's go ahead. And I'm going to put my hand right on your neck, right about here, very close to the portion where your ear lobe is, okay? So like this, right about there on both sides. And I just want you to look up a little bit and swallow very hard, okay? So go ahead. Good. And go ahead and swallow for me. Okay, and can you do that one more time? Good job. Perfect. Okay, so I'm going to put my hands on your shoulders, and I just want you to shrug. All right? Go ahead and shrug for me. Good. Very good job. And now I want you to stick your hand out. Yeah, just stick your hand out like this. And I'm going to put my hand on top of your hand. And all I need you to do is resist me pushing your hand down. Okay? Go ahead. All right, good. Good. Good job. And we're going to do the same exact thing, but I want you to put your elbows like this. And I'm going to push down on your elbow. And again, I just want you to resist. Okay? So go ahead, both sides, yeah. Okay. Good job, good job. And now, can you please put your hands like this, like we're gonna fight here. Good job. And I'm just gonna go ahead and give you a little pull, okay? I'm gonna pull and see how your strength is, all right? All right. So, go ahead and okay, good. Very good job. And now I'm going to go ahead and put my hand in the front of your shoulder, right here on your front delts. And I'm just going to give you a little push. And again, I just want you to resist, okay? Good job, good job. All right, perfect. Seems like everything is working well in that regard. So now I'm going to go ahead and check your ears, okay? I'm going to see how your ears are functioning, see everything is all right. All right, perfect. So what I'm going to ask you to do right now is to close your eyes. Very good. And I'm just going to go ahead and create some sounds. Don't worry, they're not going to be very harsh. They're going to be very soft. And all you need to do is let me know whether you hear it on the left or the right. But you're going to do that with your hand. So every time you hear it on the left, you raise your left. And if you hear it on your right, you raise your right hand. If you hear it on both, you raise both your hands. Ready? Good. Good job. Good job. Good job. Good. We're going to try a different sound now. Good. 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 Good job. Amazing. Okay. So if you remember the tweezers from earlier, here they are again. We're going to go ahead and just create a little bit of sound with them, just so that we can test out a lower sound, okay? Just a lower clicking sound, not too harsh, something very soft. And I just need you to let me know, once again, same thing as we've been doing, okay? So, once again, here we go. Eyes closed, please. Good. 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 Perfect. Good job. Doing really well so far. Gonna go ahead now and just bring in a tuning fork, okay? And here we have, this is a very low sounding tuning fork. It's designed to test out how well your hearing is. Okay, so if you can hear this one, essentially you have supersonic hearing. So here we go. So, I'm going to ask you to close your eyes for this. Okay, good. You just let me know what side you hear it on. Same thing. Okay, good. Okay. And we're going to go ahead and do that one more time. Eyes closed. Good. All right. All right. Well, seems like you're hearing. You can't hear that one too well. So let me go ahead and just grab the next one. All right. Here you have the next one. So this one, you should be able to hear it. It's a little lighter. It is a little light. It'll be hard to hear, but you should be able to hear this one. It'll be there for you. So I'm going to ask you to close your eyes once again. Good job. And here we go. Very good. And we're going to do it again. Very good. And, alright, let me go ahead and grab this other one. This one's a little hard. This one's a little louder. Okay, so here we go once again. Very good. Let me know when you can no longer hear that one. Okay, good. And once again. Okay, good. And once again, let me know when you can't hear it anymore. Good. Very good job. So I'm going to go ahead and just place this right behind your ear just to cause a little bit of vibrations in your ears, see if there's any kind of pain or discomfort. Might feel a little funny, might cause a little bit of goosebumps or something like that, but you should be okay. Like a tickly sensation. Okay, so here we go. There we go. Okay, good. And any pain or anything associated with that? Good. We're going to do it on the other side now. Good. No pain or anything? Alright, alright. Thank you, thank you. Thank you for letting me know. Let's go ahead and place this right here. Good. Good job. Perfect. Okay. So, let me go ahead and take a quick look inside of your ears. See if I got my otoscope here. Here it is. Alright. Okay, so I'm going to go ahead and just take a quick look. I'm sure you've seen this many times before and have done this in the past, right? Okay, good. Alright. Here we go. Okay. And everything looks good. Okay. Okay. Seems to be a lot of earwax, but I'm going to go ahead and say that that's probably from being frozen for so long. Okay, so let's go ahead and take a look at the side as well. Good. Okay. Yeah. Same thing on this side. Both of them have a little larger amount of earwax than the norm, but you seem to be okay. Yeah, I didn't see any kind of structural damage or anything in there that I could say would be a problem, okay? Alright, perfect. So, one last thing, I do want to go ahead and cause a few essential pinches just around. First, we're going to start in your arms, and we're going to move into your face, okay? They're very light. It's just a little squeeze, if you will. Just essentially to see if, one, you feel it in every location that I do pinch you in, but also if it causes pain, okay? So if you will, let me just give me one of your arms. Okay, here we go. pain or anything like that? Okay, so let's go ahead and do it on this side as well. Good. Good. Good job. Any pain or anything? Okay, so I'm just going to go ahead and just pinch you a few places around the face. Probably not too much, but just a little bit. Okay? So, okay. Okay. Alright. Okay. How was that? Okay, perfect. So just go ahead and enter a little bit of information right here. Okay, perfect. Okay, so everything seems to be okay. There are a few of the tests and exams that we did perform that would seem to be you're just a little slow with them. Yeah, but it's probably just been from being frozen for so long, but that's perfectly okay. I'm sure that you'll be fine within a couple days, maybe a week or so. I would like to go ahead and test you within a couple days once you feel like you've been fully rested. Again, this is only the first day that we just brought you out. Alright? Okay then. Well, thank you so much for coming in. Well, not for coming in, but essentially being a good test subject in a way. Yeah. Okay, so I will have somebody come and get you so they can take you so you can go to sleep and get your proper rest, alright? Alright, perfect. So, once again, I am Dr. Chris, and it was a pleasure taking care of you.